From children's Motrin and Tylenol to treatments for ADHD, over the last year, more people are headed to the pharmacy only to come home empty-handed. Shortages. What's behind all this? Well, the FDA still says the big reason: quality issues overseas where a lot of generic drugs are made. That's been an issue, though, for decades. They say combine that with shipping and supply chains still playing catch up from the COVID pandemic, and you get more people stocking up because of the pandemic. Well, that made things a lot worse right now. There's not always a workaround for drug shortages, and the most recent shortages are hitting life-saving drugs used in first-line therapy for a lot of cancers. Here's Sharon.
Carboplatin and cisplatin are two chemotherapy drugs used to treat a wide range of cancers. The shortage of these drugs has been reported nationwide as early as winter, but just in the past month or so, it's hit Minnesota hard.
I was diagnosed in 2014, so I'm a survivor of 9+ years, which is really great for ovarian cancer.
Cheryl, throughout her 9-year journey, has been on a chemotherapy regimen with carboplatin. While no chemo is easy, it's been the best option for her.
I've been doing pretty well. I've been pretty stable. I've been able to, get around pretty good, and, I have fatigue, but my neuropathy had not gotten worse.
But with the carboplatin shortage, along with the sister drug cisplatin shortage, Cheryl says she's been put on a different drug.
That would be not working out for me. I want to emphasize that, because my neuropathy after the first treatment was a lot worse. The numbness in my hands and feet. And so this affects my balance, my ability to motor around. Also, there's a real sensitivity to cold. The directions say put gloves on when you take anything out of the freezer. So anyway, yeah, and it hurts like pins.
Kathleen Gavin, the executive director of Minnesota Ovarian Cancer Alliance, says she's heard physicians have been given advice to extend the supply that they already have.
Give less than what is considered the optimal dose. Like they're being told give 80% instead of 100%, or give it every 5 weeks instead of every 3 weeks.
In terms of factors driving the shortage, the FDA shortage list shows a variety, from back orders to increase in demand.
As our population ages, there is a higher incidence of cancer. Carboplatin is a drug that is used for many types of cancer, and so there's just an increased need for it.
And because both the drugs are generic drugs,
there's no money to be made, or very little profit to be made in making these drugs. So the manufacturers really don't have a big incentive.
Some companies are listing late summer as their timeline for restocking the medication. Until then, Cheryl says she's going to be rolling with the punches.
When you get cancer, you think of all these bad things that can happen. This can go wrong, the chemo can stop working. I did not see this one coming. So I guess my advice is not to worry about all that stuff so much, because it might be something that you never expected.
MOCA's executive director says right now there are some doctors in the state that are managing with the supplies they have for their patients. And her advice is, if your doctor is unable to meet your needs when it comes to carboplatin or cisplatin, she recommends calling around. But certainly frustrating for all of those patients, especially to hear that generics don't make as much money, so not incentive to make them.